Hello. One of the conditions which every person who has ever witnessed is going to be terrified about is seizures. Epilepsy, seizures are conditions which humankind has always been afraid about. But one of them, that is status epilepticus, is something which is a medical emergency. So if you see status, two questions. One, how do you identify it? Two, as a medical resident or doctor tomorrow, how do you treat it? First, any seizure which has crossed a duration of 5 minutes, remember that landmark. Any seizure crossing 5 minutes or a person having episode of seizure, then lost consciousness, had one more seizure before regaining consciousness, this should be considered as status epilepticus. The first line of action for you is to stabilize the patient. Ensure that the patient does not get injured, ensure that the airway is patent, and if possible give a lateral position. Second step is, as soon as possible, administer benzodiazepine. Now the drug of choice is either Midazolam or Lorazepam, and in Indian scenario you will find very often Midazolam is available. Of course, take care that there should not be respiratory depression when you do that. The third step is to start an anti-epileptic drug. Now there are three choices. First is Levetiracetam, which is the preferred drug. Second is Valproate, and third is Fosphenytoin according to the guidelines. But in India, what is preferred is Levetiracetam. And last but not the least, if the patient still does not improve, shift to the ICU, intubate, and consider anesthetic agents. I hope this helps you when you next see a patient with status epilepticus.